Welcome to this recorded presentation on the topic of post-retirement health, offered to you by the Harvard University Benefits Office. We are delighted to have you here and hope that by the end of this presentation, you will have a better understanding of what post-retirement health includes and how you meet the eligibility. An important note before you begin. This presentation has an accompanying list of frequently asked questions that we collected from those who have attended the live webinars of this presentation. You can find the link to this FAQ on harvey.harvard.edu/preparing-retirement, along with a PDF of today's slide presentation. Please note that because this presentation is a recording, you cannot click on the various hyperlinks here, but you can by downloading the presentation PDF just mentioned. Let's get started. We will start by defining post-retirement health, also referred to as PRH, and the Rule of 75, and then focus on the eligibility criteria that makes up the Rule of 75. Next, we will review how the post-retirement health benefits work if you retire under the age of 65 and if you retire over the age of 65, including the topic of Medicare and the supplemental medical plans available to eligible Harvard retirees. We will then move on to retiree dental and life insurance, followed by a brief mention of the Harvard University Retirement Program benefits, and then wrap up the presentation with important timelines for starting the retirement process. What is post-retirement health? Post-retirement health is a term that refers to the benefits of retiree medical, dental, and if eligible, retiree life insurance. And you must meet certain eligibility criteria to receive these benefits. Once you meet this eligibility criteria, known as the Rule of 75, you do not need to meet it again. For example, if you were to leave and come back. Your spouse or registered domestic partner at the time of your retirement, as well as your eligible children, are also entitled to be covered under the retiree medical and dental benefits. However, you, as the retiree, must be enrolled in a Harvard University retiree medical and/or dental plan in order for your eligible dependents to be covered. Now that we have covered the benefits that are included with post-retirement health, which includes retiree medical with prescription drug, dental, and if eligible, life insurance, you may be asking what the eligibility criteria is for obtaining these benefits, which is also known as the Rule of 75. Eligibility for post-retirement health benefits is met when your age and years of participation service equals 75. Participation service is the type of service credit you earn while participating in one of the university-funded retirement programs. The Rule of 75 criteria comes along with age and service minimums, either 55 and 10 or 60 and 15. Which set of minimum requirements applies to you will depend on when you were hired or rehired, plus if you are a member of a union, to which union you belong. On this slide, we see the details of the age 55 and 10 years of service minimum requirements. Let's see how this differs if you are hired or rehired after the dates listed on this slide. Here we see the details of the 60, 15, 75 eligibility. Looking at the dates shown here, you see that as of 1/1/2014 for non-union employees, and as of 1/1/16 for most union staff, and as of 1/1/2020 for SEIU Arboretum members, the Rule of 75 age and service minimum requirements changed from age 55 with 10 years of service to age 60 with 15 years of service. Harvard employees who meet the Rule of 75 and retire before the age of 65 are eligible for the under 65 medical plans until you become eligible for Medicare. These are the same plans that are offered to Harvard's active employee population and are shown here on this slide. And as there are changes to these active plans, the under 65 retiree medical plans change. During the annual open enrollment, any plan or rate changes are communicated to both our active employee and retiree population. Please note, if you were contributing to a health savings account, or HSA, your participation will end upon your retirement from Harvard. However, you continue to have access to the money in your account for your eligible healthcare expenses. For example, you can use your HSA funds to pay for your Medicare premiums. However, the premium you pay for your Harvard retiree medical plan is not an eligible HSA expense. And for those who are a member of the faculty or are a non-union staff member, please note that the PPO and the high deductible health plans are offered only through Blue Cross Blue Shield of Massachusetts. We have talked about what is post-retirement health and how you become eligible by meeting the Rule of 75. Now you might be wondering, what is the actual benefit to meeting the eligibility? One of the benefits is that the university provides a subsidy towards the cost of your retiree medical benefit, the structure of which is listed here next to the retiree contribution box at the bottom of the slide. And these retiree benefit rates are broken down by waves, ranging from Wave 1 to Wave 4. Which wave applies to you depends on when you were hired or rehired, when you became or will become eligible, your years of service, and your employee group. You can find the current retiree rates listed by wave and employee group at harvey.harvard.edu/plan-rates-features and as listed on the top of this slide. Harvard employees who meet the Rule of 75 and are age 65 or older are eligible to enroll in one of the Medicare supplemental plans. The change here is that Medicare becomes your primary insurance, which means it pays first. The balance is billed to your secondary insurance, also known as your Medicare supplement. As you see on this chart, Medicare A has no premium, but Medicare B has a standard monthly premium plus an additional premium for those earning above certain thresholds, known as IRMA, or Income-Related Monthly Adjustment Amounts. Medicare Part D prescription drug costs through Express Scripts are included with each of the Harvard Senior plans. That said, you may be subject to IRMA, which is a sliding income scale for additional costs for Parts B and D. You can find Medicare information and rates at medicare.gov/basics/costs. The website is also shown at the bottom of this slide. When you retire and are over the age of 65, Medicare becomes your primary insurance. Medicare is comprised of hospital inpatient insurance, or Part A, and doctor services, outpatient treatment, including labs and testing, or Part B, as well as prescription drug coverage, or Part D. You can also purchase supplemental medical insurance to fill in the gaps. Harvard offers 2 Medicare supplemental insurance plans, and you must be enrolled in Medicare Parts A and B to enroll in one of these plans. We will go over these supplemental insurance plan offerings, plus the prescription drug coverage offering, on this slide and the next. These plans, while they all supplement Medicare, operate a bit differently. The Blue Cross Blue Shield MedX plan has deductibles and coinsurance, while the Harvard Pilgrim Healthcare Medicare Enhanced plan has copayments. Please note, the prescription drug coverage is through Express Scripts Medicare, and if you live outside of the U.S. and are enrolled in the Blue Cross Blue Shield MedX plan, your prescription drug coverage will not be a Medicare D plan. However, Your copayments will be the same as the US-based MEDEX plan. There are many supplemental plans outside of these Harvard offerings as well. We have talked about the under 65 cost-sharing structure. Now you might be wondering how it works for over 65 retirees. The cost-sharing structure is shown here next to the retiree contribution box at the bottom of the slide. For over 65 retirees, the subsidy amount is driven off of the full cost of the Blue Cross Blue Shield MEDEX plan, and which wave applies to you depends on when you were hired or rehired, when you became or will become eligible, your years of service, and your employee group. You can find the current retiree rates listed by wave and employee group at harvey.harvard.edu/plan-rates-features and as listed at the top of this slide. Harvard's retiree dental plan is different from the active plan in that there is no university subsidy. Retirees pay the full premium cost. You can enroll in retiree dental at the time of your retirement. The other time you are eligible to enroll is if you deferred your retiree medical and dental coverage at retirement. You can enroll in retiree dental at the same time that you are enrolling in retiree medical. If you do not enroll in retiree dental at one of these two times, you will not be able to do so later. Some of the current plan highlights include a calendar year maximum of $5,000 per covered person, 100% coverage for preventative, 75% for basic restorative, which is the same as the active plan, and 50% for major restorative. There is no orthodontia coverage. For more plan detail, visit the dental section at harvey.harvard.edu/retiree-health, as well as the plan details on metlife.com/harvard-dental. Harvard's retiree life insurance benefit consists of your basic life insurance and, if enrolled, your supplemental or contributory life insurance. Retiree basic life insurance is offered at no cost to you. And if the value of your basic life insurance coverage is greater than $50,000 at the time of retirement, it will be reduced to $50,000. If you are enrolled in supplemental life, that benefit may continue if you pay the premium. If you have more than 1 times your salary in supplemental life, you can reduce the value in increments of your salary. Retiree life insurance coverage will reduce by 35% on July 1st following your 66th birthday, or 65th if you are an hourly employee, and will cease effective July 1st following your 70th birthday. And if you happen to retire at age 70, your basic and supplemental life insurance coverage will end on the June 30th following your 70th birthday. You will receive letters in the mail when the reduction and cancellation process happen, detailing your ability to convert or port the lost coverage into an individual policy directly with MetLife. Although the focus of this presentation is post-retirement health benefits, we wanted to mention the university-sponsored retirement plans and the distribution options that are possible once you retire. The university offers 3 university-funded retirement programs to help provide eligible employees and their families with financial security after their working years. Depending upon your employment type, you may be eligible for the 1995 retirement program, the 2001 staff retirement program, or the retirement income plan for teaching faculty. These 3 Harvard programs have a 3-year vesting schedule. Vesting means ownership of the funds contributed by the university on your behalf. The university also offers 2 employee-funded retirement programs. The TDA, or Tax Deferred Annuity Plan, is a voluntary employee-funded plan and your contributions can be made on a pre-tax basis or Roth after tax, or both. The 457B Deferred Compensation Plan is for higher income earners to contribute additional savings. Special compensation requirements apply. All retirement benefits plus earnings are taxable income when distributed unless you have used the Roth investment option within the TDA. We encourage you to refer to the retirement section under Benefits and Rewards on harvey.harvard.edu for more details. Distribution options vary based on the Harvard plan you have participated in. And depending on your age at the time of retirement, you will need to factor in the required minimum distribution rule. We recommend setting up an appointment with your financial planner and/or with one of the TIAA representatives to go over the specifics of your financial needs and plans. For those of you who may be closer to retirement, you may be wondering how to prepare and what is the timeline. Before we get to that timeline, please take some time to review this slide, which provides the steps to follow when using the Post-Retirement Health Eligibility Calculator. This is where you go to determine your own post-retirement health eligibility date. Now that you have determined your post-retirement health eligibility and are considering your retirement, you may be wondering when is a good time to contact the benefits office to discuss the process. The earlier you start to prepare, the better. And here is a list of suggested steps as you get closer to your retirement date, about 3 to 4 months out. Speak with your financial advisor or set up a one-on-one with TIAA, or both. Set up a one-on-one meeting with your benefits business partner or consultant. If you and/or your spouse will be age 65 or older by your retirement date, you need to enroll in Medicare A if you don't already have it, and Part B. Notify your department and your local HR or faculty affairs contact. And if you are a staff employee, consider your options for unused vacation. You can take it in a lump sum or defer to your TDA account. Please note, there is still some taxability for rolling your unused vacation dollars to your TDA, which is explained in detail on the form that you need to complete. You can get the form from your local HR. One other important timeline, if you are over age 65, is 1 month before your date of retirement. You should call the Medicare Coordination of Benefits at 1-855-798-2627. The phone number is also listed here on the slide, and notify them of your retirement date. You'll have one additional step if you receive your care at Harvard University Health Services, or HUHS. You need to call the HUHS registration department and give them your retirement date and your Medicare insurance information. And before we wrap up this presentation, I want to share a list of resources for you to review. All of them can be found on harvey.harvard.edu. This includes a page dedicated to preparing for retirement, a retirement checklist, the resource documents on what happens when you retire, and what happens when you and your spouse or registered domestic partner turn 65. And don't forget to review the websites for the Social Security Administration and Medicare. And as we wrap up this presentation, we want to remind you that if you have any questions about the retirement process or where to find more information on post-retirement health and the Rule of 75, to please contact us here at the Benefits Office. And don't forget to review the accompanying FAQ and PDF version of this presentation on harvey.harvard.edu/preparing-retirement. Thank you for your time and interest in the topic of post-retirement health.